So a very good morning to everybody. Hopefully you all can hear me, students. So today we are going to discuss on the topic of nosocomial infection. So another meaning of nosocomial is what? I hope that you all know that another meaning of nosocomial infection is hospital acquired infections. Okay. So let us briefly discuss about this hospital acquired infection or nosocomial infections. So hospital acquired infections is defined as acquiring an infection in the hospital by the patients or others. This is the definition. It is the infection which is acquired during the stay of the hospital, okay, during an infection in the hospital by the patients or others during their stay. It is not only by the patients, but it can be by the attendees. The infection can be acquired by the attendees also of the patients. So when they acquire it in the hospital environment, okay, during their stay, okay, but manifesting either during the hospital stay itself or after discharge. So it is not that during the hospital stay most of them are manifested, but sometimes it may be manifested even after discharge from the hospital. But the infection is acquired during the procedures or during the stay of the hospital. Those kind of infections are called hospital acquired infection. So I am repeating the definition once again. The hospital acquired infection is defined as acquiring an infection in the hospital by the patients or others during their stay and manifesting either during the hospital stay itself or after discharge. So you have to be very clear with the definition. It is also known as nosocomial infection. Okay. Now the prevalence or the occurrence of hospital acquired infection is higher in the developing countries. Like in Southeast Asia, it is very high, and it is very high in India, where our hospital environment is not very sterilized, or most of the time it is not a hygienic environment. Okay, we don't follow the standard infection control procedure. So in India it is around 25 to 40%, whereas in the developed countries it is only 7 to 12%. Okay, in India it is around 25 to 40%. Overall in Southeast Asia it is around, you can say it is around your 20%, 17 to 20%. However, in India it is quite high. Now another thing that I want to say here is the occurrence of COVID-19 infection. So it has been seen from several studies that has been published that the occurrence of COVID-19 hospital acquired infection is also very high. It is a highly transmissible disease, we all know, and so in COVID-19 the transmission of the infection in hospital setting, it is around 41%. It is very high compared to the other infectious diseases. Okay. So now with that, the importance of hospital acquired infections has become, with the onset of COVID-19, it has become more relevant now. We have to be more cautious. We have to use more standard infection control procedures. Okay, so let us see what are the causes. Overall, what are the causes of hospital acquired infection? So what are the predisposing factors? Okay, so let us see this. Number one is development of drug resistance by the microorganisms. So how we are predisposed? One is the hospital environment is full of drug resistant microorganisms. We have we prescribe drugs which are sometimes unscrupulously prescribed, isn't it? So what happens in India actually with the use of these prescription drugs? We have a high rise in the drug resistance of the microorganisms. So there is a high rise, and most of the hospital infections are by these drug resistant microorganisms. Okay, and so development of drug resistance by microorganisms is one of the predisposing factor. Then overcrowding of hospitals. So in our hospitals, if we go to our district hospital, if we go to the other PHCs and all, also in the indoor facilities, we see there is a lot of overcrowding, isn't it? So this is one of the important predisposing factors for hospital acquired infection. Then again in hospital, which kind of patients come? Those patients who are already sick or who are already immunocompromised, isn't it? So these patients, they are already susceptible to different kind of infections. Like example, patients suffering from tuberculosis, leprosy, diabetes, severe protein energy malnutrition, anemia, cancer, old age patients, and patients on steroids and cytotoxic drugs. So these type of patients are mostly there in the hospital. So the chances of acquiring the infection is also very high, especially for COVID-19, isn't it? So these are some of the predisposing factors. Apart from these are the core predisposing factors, there can be other predisposing factors like the environment of the hospital itself, isn't it? Then the health status of the healthcare workers, how do they maintain the hygiene or infection control procedures. So all these it depends. Okay, the incidence of hospital acquired infection, it is not constant, it varies from place to place, that's why. Okay, so what are the etiological agent? Till date, we have seen that most of the hospital-acquired infections are due to staphylococci. Okay, around 50% of hospital-acquired infections are due to staphylococcus. Okay, which is very high still now. Then we have the gram-negative bacilli, which causes around 45% of the hospital-acquired infections. Okay, gram-negative organisms. These are E. coli, okay, Klebsiella, Proteus, Pseudomonas species, Salmonella and Shigella. Okay, these are very Clostridium also. Clostridium difficile is one of the important causes of your hospital-acquired diarrhea. Okay, some people, they develop diarrhea. So this is because of Clostridium difficile. And so 45% are due to gram-negative bacilli and 5% are caused by the other organisms. Like, though we highly fear about HIV and HBV, but the incidence of them are very less, because first of all we already follow the very standard safety precautions for them, and so they are only responsible for 5%. So viruses, protozoa, rickettsia, fungi and all, they are responsible for 5% of the other hospital acquired infections overall. Okay. Of course, now the figures are changing with the onset of COVID-19, but more or less this is the scenario for hospital-acquired infections. Most are due to staphylococci, 45% gram-negative bacilli, and 5% are caused by your virus, protozoa, rickettsia, and your fungus. This actually, initially, no, we had 4 types of hospital-acquired infections. Now the definition or the type of nosocomial infection, it has broadened. Okay, so let us see what are the different common types of nosocomial. So we define nosocomial infections or types into 5 categories of nosocomial infections are there. Let us see what are those. Okay, one is a surgical site infection. Okay, so what is that? Any purulent discharge, okay, or abscess or cellulitis at the surgical site during the month after the operation. So if you when you will later on you will do dressing of the patients, you will see that the surgical site wound is a very sterile wound. Okay, there is usually no pus, it's a very cleaned wound, but sometimes you will see that pus is coming out from that stitch. Okay, or purulent discharge is coming out, or it has become very red and discharge is coming out. So that you can suspect that immediately there is some kind of infection has entered in the OT setting, operation theatre. So that is a surgical site infection. Okay, so it may develop after immediately of the operation or within a month after the operation. Okay, so that you can classify as a surgical site infection. Then another very common kind of nosocomial infection is the urinary infection. Okay, urinary tract infection. So what is that? Positive urine culture. So if the culture of the urine comes positive, okay, with either 1 or 2 species, this is a standard definition of this one, urinary infection for nosocomial, with at least 105 bacteria per ml with or without clinical symptoms. Suppose if we do the urine culture and see that the positive culture is positive, so then we can say that the patient has acquired a urinary tract infection from the hospital, if it is during the hospital stay or even immediately after the hospital discharge. Then respiratory infection. What happens here? Respiratory symptoms with at least 2 of the following signs appearing during hospitalization. What is that? Cough. The patient will have cough, purulent sputum and new infiltrates on chest radiograph, which are consistent with the infection. Okay, these are respiratory infection. So it is the third, it is one of the type of nosocomial infection. And now we have to be very alert with the onset of COVID-19. Any patient, now it happened also in NEIGHRIMS, in orthopedics ward. One patient, he was being he had come for operation and suddenly he started developing respiratory symptoms, isn't it? So, and then his sample was taken, so and then it appeared to be COVID-19. But of course you cannot say that he had acquired the infection in the hospital setting. You cannot say for sure, because he must have acquired in the community also. But overall we have to be very alert now. whether so that is why contact tracing and other things are very important now in the context of COVID-19. We have to see whether where the infection has been acquired, whether it is from the community, from the history, or in the hospital setting. Okay, so as such, respiratory symptoms, if they develop, then we have to be so if there is infiltrates, if there is sputum, if there are cough is there, then it can be a during the hospital stay, then it is a nosocomial infection of the respiratory tract. The fourth type of nosocomial infection is the vascular catheter infection. So what is there in vascular catheter? At the site of catheterization, there will be inflammation, swelling of the lymph nodes, or purulent discharge. Like the surgical site, there will be same here. They will be at the catheter site, insertion site of the catheter, there will be a swelling of the lymph nodes, inflammation is there, and there will be discharge. And lastly, septicemia. It is one of the most dreaded type of your nosocomial infection, isn't it? Where there may be, because it may lead to multi-organ failure also. So here the patient will have fever or rigors and at least one positive blood culture. So these are the 5 common types of nosocomial infection. So mostly these infections are there which are acquired in the hospital setting. Either of these can happen. So it may be either surgical site infection or urinary infection or infection of the respiratory tract or the vascular catheter infection, or there will be septicemia. Okay, so you have to remember these types of nosocomial infection with the definitions. Okay, it is very important. So we have discussed till now about the definition, about the predisposing factors, the prevalence and the types. Now let us see how we get the nosocomial infection. So there are 3 important sources. One is auto-infection, that means from the patient's own flora. So the patient, suppose he touches, from his own hands, it may get contaminated to other parts of his body, isn't it? So that is auto-infection. Then from another patient, suppose he has shared his thermometer with another patient, or clothing, or anything. So from the flora, or by touching the patient also directly, or by droplets also, any kind of cross infection from another patient. Okay, so and so transmission may occur by direct contact. So direct touching among the patients, by the air when they talk, through the droplets, and also by the staff. Sometimes the staff may also bring the infection. And the environment. So environment, from where do they get? It may be from the air, the hospital air and the hospital dust, and surfaces which are contaminated by patient's secretions, blood and body fluids, any kind of surface. Okay, so then the inanimate objects, okay, which are also called fomites, okay, like the thermometer or the blood pressure machine. Okay, these are the inanimate objects of which may carry the infection. Okay, so these are the sources and also the reservoirs of infection. So in the source, the infection is there. In the reservoir, the bacteria or the agent will not only be there, but it also multiplies. So in the human beings, mostly they are the reservoirs of, or the healthcare staff is also one of the most important reservoirs of this hospital acquired infection. So these are the reservoirs and sources. So if you see in all these, who is most important in transmitting the infection? How does the surfaces get contaminated? Or so it is the man, it's a human being only which occupies a central position in the overall cycle of your nosocomial infection, isn't it? So human being, not only he acts as a source, he acts as a reservoir of microorganism, he will act as a disseminator, that means he will act as a spreader, he can spread, and he will also act, and another human being acts as a recipient. So the most important thing that we have to look after is the human being itself. He is the source of the infection, he can spread the infection, and he is also a target or the recipient of the infection itself. Okay, so this here this is a crucial thing to break the chain of transmission. No, we have to target, we have to look for the infection, or we have to be very careful about the host or the reservoir, which is the human being itself. Okay, so all patients in the hospital are potential recipients of cross infection. Whenever any patient come, we have to presume that. So that's why when we were small, children usually are not allowed to come to the hospitals. No, when we were small, we were not allowed to go. Why? Because it is a contaminated environment overall, and we can consider that all patients or all attendees, they are potential recipients of this infection. Okay, what is the age incidence? So it can occur in any age groups, but it is very high in pediatrics and mostly in the geriatric age groups. And it is equal, the sex in the gender, it is equal in both males and females. There is no predilection. So mode of transmission, how it is transmitted. So I have already discussed this, just recapitulating: by direct contact, by droplet infection, okay, by infected dust. Suppose if there is dusting or other procedures are being done, then the hospital environment becomes contaminated with the dust of the and which is microorganism is already there in the dust. So if you inhale that contaminated dust, by inanimate objects or fomites, and by some procedures which we carry out in the hospital, like inserting a catheter, maybe a urinary catheter or IV cannula, okay. So by parenteral or percutaneous route while carrying out the hospital procedures, through those also the infection can be transmitted. So these are called iatrogenic. The iatrogenic infections you must have studied in pharma, which are acquired due to some procedures which are done in the hospital acquired procedures done in the hospital, okay. So these are the modes of transmission of the hospital acquired infection: by contact, by droplets, which is most droplet infection is now very common for COVID, by dust, by fomites, and by parenteral or percutaneous route. Now coming to the prevention and control, okay. So let us see what is there in the elimination of, the first thing in prevention and control is elimination of the reservoir or the source, okay. So who is the source and who is the reservoir? Everything is the human being, okay. So what do we do here? Firstly, we care so if you have to eliminate the source or the reservoir, you have to take care of the staff, number one. So all the staff should follow strict aseptic precautions. Number one, they have to do frequent hand sanitization, frequent hand washing. They should not touch the patients consecutively without washing their hands, okay. Then and then they have to get themselves checked also. If they are having any infection, they should not come for duty, isn't it? So that they can prevent the spread of infection. So one is care of the hospital staff, use of proper PPE now especially, isn't it? Then care of the patient. So secondly, the patient is also a potential recipient, and also the patient can spread the infection to others. So for the patient, what do? Use of isolation wards, okay. So we prescribe the use of chambers you have seen, no, like proper isolated rooms, especially isolation ward. Cubicles we have separately so that the patients do not mix up with each other, and open wards or general wards where the patients minimum distance is there between the beds, so that there is no transmission of infection. But open wards or general wards are hazardous in terms of spread of infection. Then the treatment of the patient is very important. Whenever we do, the treatment should be correct and complete with specific antibiotics. Most of the time, what we do, we prescribe antibiotics one after the another. The patients, they don't complete the course of the antibiotics also, and that's why there is increase in drug-resistant microorganisms. So we should be ensuring as healthcare professionals that whatever treatment they take, it should be correct and complete with the antibiotic, the schedule should be completed. Nursing care. So again the nurses, how they can prevent the spread of infection. The care, one is barrier nursing. What is barrier nursing? The one that we are following now for COVID-19, isn't it? So wearing of gowns, gloves, masks while in contact with the patient, okay, everything, so that it acts as a barrier to the spread of infection between the patient and the healthcare staff. Another one is task nursing, posting special nurses for special duties. Now we are also following that, isn't it? Nurses specially posted in the COVID ward or COVID isolation ward or COVID ICU. We have special set of staff. They do duty and they get themselves tested for COVID-19. If they are negative, then only they can again resume their work. So that is task nursing. Okay, we are not mixing the staff with each other. And barrier nursing. So these are some of the ways to prevent the spread of infection. So the human beings, we have to be very careful, both from the patient side and from the nurses or the doctors also. Everyone should be careful. So breaking the channel of transmission. Breaking the channel of transmission, this word has been repeatedly used in the context of COVID-19. So let us see, what do they do? What should be done? Washing and disinfection of hands prevents contact transmission. Isolation of infectious cases. concurrent disinfection of infectious discharges. What is concurrent disinfection? There are 3 types of disinfection, no, precurrent, concurrent and terminal. Today you just go and read what is precurrent, what is concurrent and what is terminal disinfection. Very important. Concurrent means as soon as the discharges come out from the body of the patient, they are immediately decontaminated. Suppose when the patient coughs, the patient should cough in a container which is already filled with sodium hypochlorite, the solution, the antiseptic solution, so that as soon as the sputum comes out, it is automatically decontaminated. So that is concurrent disinfection. Okay, immediate disinfection will have to be there. So this is one of the important things that can be followed. Control of hospital dust. So in hospital, have you seen anyone brooming? They just do mopping. Even in when you have seen in the hospital, in the corridors, they will never use a broom or this one, no, vacuum cleaner. What they do, they just use mops, isn't it? So mopping is one of the best ways to control the hospital dust. So ideally, the hospital should be mopped twice a day for control of the hospital dust, so that there is no dissemination of the dust particles into the environment. Okay, so control of the hospital dust. And droplet transmission can be prevented by, number 1, avoiding overcrowding, enough bed spacing, okay, adequate ventilation should be there, and observing strict aseptic precautions during hospital procedures. Okay, strict aseptic precautions or universal safety precautions during hospital procedures. So in terms of prevention and transmission, one is your reservoir and source has to be eliminated, which is the both the patient and the healthcare staff, be it the doctor or the nursing person or the laboratory technician, okay, or the attendant, anyone. Then breaking the channel of transmission, okay, and breaking the channel of transmission, we continue then meticulous care of post-operative dressings, safe disposal of hospital refuse, and hospital premises to be kept clean both inside and outside. So this is about the how we break the channel of transmission, so that so that there is no transmission from the source to the host. Okay, so we have to follow the aseptic precautions. And thirdly, protection of the susceptible persons who are likely to get the infection. So all these susceptible persons should be admitted in isolation wards. Then we have vaccinations for people who are very highly susceptible, like we have hepatitis B, tetanus. Injections should be taken by all healthcare staff also, and universal blood and safety precautions to be adopted by all healthcare workers. Okay, this is very essential. So we have 3 things. One is the reservoir we have to eliminate, we have to break the channel of transmission. Everything should be followed, which is already discussed. So many things in COVID-19. So now the concept of these channel of transmission, the breaking the chain of transmission has become more prominent with the onset of this COVID-19. And then thirdly, we protect the host or the susceptible persons. Now let us see what are some administrative measures that should be taken in each and every hospital. In each and every hospital, even in NEIGHRIMS, we have a hospital infection control committee. Okay, it is very critical actually, this hospital infection control committee for surveillance of hospital infection, hospital acquired infections. Okay, so it consists of the microbiologist, the infection control nurses, the sanitation officer, okay, everyone, a physician, okay, a public health specialist, everyone should be there to look into these aspects of the hospital acquired infections. A little, 1 or 2 lines about this universal safety precautions. So these are a set of precautions which are being prescribed by the WHO now to prevent the spread of infection especially in the healthcare setting. Okay, so they have it's a big long list of so if you go into the website and just type universal safety precautions, many things will come out. I suggest that you can just read about this basic universal safety precautions. Okay, and I will give you the link also about ICMR website. So what is there in the universal safety precautions? First, they have cited about the barriers of infection. Okay, how we can prevent the spread of infection. One is use of personal protective equipments, isn't it? Like, what are some personal protective equipments that we have been using? Before the onset of COVID-19, we used to wear gloves, isn't it? For any contaminated procedures, we used to wear gloves. Then then we have mask. Then when we conduct surgery or other procedures, we always used to wear our gowns. And now with the onset of COVID-19, we have the full set of PPE, which is already lots of things are there. We have the face shield, we have the gloves, isn't it? Then we have the whole hazmat suit, which is there covering the whole body. On top of that, again, there is a plastic covering, isn't it? Then boots, cover for the boots. Everything is there in our PPE. And there is a sequence also of how to wear the PPE, which is called donning, and how to remove the PPE, which is called doffing. Okay, we will discuss this later. So there is a there are some nice videos also of donning and doffing. So PPE, they very nicely they have cited how to wear this PPE, what are the guidelines to be followed. Okay. Then engineering controls, like some procedures in the hospital, how to be carried out, separate space for the laboratories, especially for the isolation ward should be separate, isn't it? These are some of the things that should be there. And work practice controls, that means like in the workplace, what infection control procedures we have to follow. So infection control practices, basically we have the standard precautions, and then we have the transmission based precautions also. Transmission based precautions for prevention of transmission, like this droplet infection or direct contact, isn't it? So basically these things consist of hand washing, which I have already told you. So sanitization of all the equipments which have been used by the patient. Okay, so all these are coming under the infection control practices. So infection control committee in the hospital, just quickly I will tell you what are the roles. So this infection control committee, they have to review and approve a yearly program of activity for surveillance and prevention of hospital acquired infections, and to review epidemiological surveillance data and identify areas for intervention, to assess and promote improved practice at all levels of the health facility, to ensure appropriate staff training in infection control and safety. Staff training is very essential so that they know about how to wash their hands, okay, and where to throw the waste. These are very important parts of staff training, aspects of staff training. To review risk associated with new technologies and monitor infectious risks of new devices and products prior to their approval of use, to review and provide input into investigation. So any hospital acquired infection any infection in the hospital, suppose 5 or 6 cases of wound infection has come up in surgical ICU, immediately it should be investigated. How come this has happened? Or sometimes after surgery of the eye, after cataract surgery, the patient may develop your eye infection, it's a dreaded complication. The patient may lose the eyesight. So why this has happened? Has the OT equipments not been sterilized, or the hand washing procedure was not used properly, or the gown was not properly sterilized, or the OT instruments were not properly sterilized? Everything has to be investigated by the hospital infection control committee. Then to communicate and cooperate with other committees of the hospital with common interests, such as pharmacy and therapeutics, antimicrobial use committee. Every hospital should have a microbial policy, how to use the antibiotics. That also is very important. Biosafety or health safety committee and blood transfusion committee. So here I have given you a link. So just see there, one link is there, that users the desktop hospital infection control guidelines. You can just click or just copy this link, or I will put this slide also in the Google Classroom. So what you do is that you can just read through this hospital infection control guidelines. This is by ICMR. Okay, it's a very nice set of guidelines. You can just, if not the whole document, just read the important parts of the document so that you get an idea about this hospital infection control guidelines. I have just told you a little bit about it because discussing the whole thing is not possible, isn't it? So with that, I have come to an end of today's class. So just a quick recapitulation of what we have discussed. So we have discussed about what is the definition, what is the prevalence, what are the predisposing factors, what are the etiological agents, what are the important types of nosocomial infection. We have discussed there are 5 types. Then who are the sources and reservoirs and how it is disseminated, and prevention and control measures. One is the elimination of the source or the reservoir. Number 2 is breaking the channel of transmission, and number 3 is protection of susceptible persons. Remember these points. And finally, in every hospital, there is the Hospital Infection Control Committee. And then we have the universal safety precautions which are to be strictly followed for prevention of nosocomial infections. Okay, and this is the link for the ICMR guidelines. Thank you so much for attending. That's all I have today. Thank you.
Thank you, ma'am.